The emergency room doors slammed open. Colonel Daniel Cross stumbled through, his face twisted in agony, his dress uniform soaked with sweat. Every eye in the waiting room turned toward the decorated Marine, medals gleaming, posture rigid despite the pain radiating through his body. When the only available nurse stepped forward to help, he locked eyes with her faded civilian scrubs and sneered. "Get me someone qualified," he spat, his voice sharp enough to cut glass. "Not some washed-up nobody playing hospital." The woman didn't flinch. She simply stood there, watching him with eyes that had seen worse than his contempt. What he didn't know, what nobody in that room knew, was that dismissing her would be the last mistake he'd ever make. Before we dive into this incredible story, I want to invite you to stick with me until the very end. If this story moves you, please hit that like button and drop a comment telling me what city you're watching from. I love seeing how far these stories travel across the world. Now, let's get back to what happened that night at Riverside General. The fluorescent lights of Riverside General Hospital hummed with their usual monotonous drone as the evening shift settled into rhythm. Nurse Evelyn Ward moved through the emergency department with practiced efficiency, her movements economical and precise. At 52, she carried herself with a quiet competence that younger nurses often mistook for weariness. Her scrubs had seen better days. The navy blue fabric worn soft at the elbows, a small bleach stain near the hem that wouldn't come out no matter how many times she washed it. She'd been at Riverside for 6 years now, ever since relocating to Portland. 6 years of night shifts, difficult patients, and the kind of medical emergencies that kept her skills sharp even as hospital politics tried to dull her spirit. The waiting room held the usual Friday evening crowd. A teenager clutching his basketball-injured wrist, an elderly woman with her worried daughter, both speaking in hushed Spanish, a construction worker with a gash across his forearm wrapped in a blood-soaked towel. Evelyn had just finished triaging a case of suspected appendicitis when the automatic doors burst open with a force that made everyone jump. Colonel Daniel Cross didn't walk into the emergency room. He commanded it. Even hunched with pain, his presence filled the space like a physical force. The Marine dress uniform told part of his story. The rows of ribbons spoke of deployments, commendations, battles fought in deserts and mountains halfway across the world. But it was his bearing that truly announced him. The rigid spine, the sharp eyes that assessed and cataloged everything in a fraction of a second, the jaw set against pain that clearly had him in its grip. "I need orthopedics," he announced to the room at large, his voice carrying the expectation of immediate compliance. "Now!" The intake nurse, a young woman barely 2 years out of nursing school, fumbled with her clipboard. "Sir, if you could just have a seat and fill out, I don't have time for paperwork." Cross's words came through gritted teeth. His right hand gripped his left thigh, knuckles white with pressure. "I have a meeting with General Hartwick at 0600. I need this fixed tonight." Evelyn moved forward, her assessment already beginning. She noted the pallor beneath his tan, the fine tremor in his hands despite his attempt to stand at attention, the way his weight shifted subtly away from his left side. "Sir, I'm Nurse Ward. Let me get you into a triage room, and—" Cross's eyes cut to her, taking in the faded scrubs, the gray-streaked hair pulled back in a simple ponytail, the absence of any military bearing. His lip curled slightly. "Are you military medical?" "I'm a registered nurse with 28 years of emergency experience," Evelyn replied evenly. "I need to assess your condition before—" "That's a no." But Cross turned away from her, scanning the department with increasing agitation. "Where's your military liaison? Your trauma surgeon? Anyone with actual combat medical training?" The waiting room had gone silent. Even the teenager had lowered his phone, sensing the tension crackling through the air. The intake nurse looked between Evelyn and the colonel, uncertainty written across her young face. Evelyn felt the familiar weight of being dismissed, being deemed insufficient by someone who had already decided she wasn't worth his time. She'd felt it before, from doctors who saw her age, from patients who demanded younger nurses, from administrators who valued credentials over competence. But something about Cross's particular brand of contempt struck a different chord, the way he looked through her rather than at her. The assumption that civilian meant incompetent, the absolute certainty that his judgment was correct and final. "Sir," Evelyn kept her voice level, professional, "this is a civilian hospital. We have excellent physicians and surgeons, many with military backgrounds, but Right now, I need to evaluate your symptoms to determine priority level. And priority level? Cross's laugh was harsh, edged with pain. Lady, I've had combat medics patch me up in firefights while rounds were still coming in. I've been stitched up in forward operating bases with equipment that wouldn't pass inspection in a veterinary clinic. I don't need some civilian nurse who's probably never seen anything worse than a skateboard accident telling me about priority levels. The words landed like slaps, each one calculated to diminish. Evelyn felt the stares of the other patients, the discomfort of her colleagues within earshot. The teenager's mother had pulled her son closer, as if the conflict might somehow spread. The elderly Latino woman's daughter whispered a translation, and both sets of eyes turned toward Evelyn with a mixture of pity and secondhand embarrassment. I understand you're in pain, Evelyn said, and she did understand. She could see it in the micro-expressions that flickered across his face when he thought no one was watching, in the way his breathing had become shallow and controlled. But you need to get me someone qualified. Cross's voice rose, command presence overtaking pain management. I didn't serve 3 tours and earn these stripes to be pawned off on whatever burned-out civilian couldn't hack it in real medicine. The burn of the insult was immediate and sharp, but Evelyn's expression didn't change. She'd learned long ago that reaction was what bullies wanted, what they fed on. Instead, she simply nodded once, slowly. Understood, sir. I'll inform the attending physician of your preference. She turned to walk away, but something made her pause. Some instinct honed over decades of emergency nursing, the kind that whispered warnings when vital signs were about to crash, that sensed sepsis before the labs came back, that knew the difference between pain and crisis. She glanced back at Cross, really looked at him with the full weight of her experience behind her eyes. His color was wrong. Not just pale. There was a grayish undertone creeping in at his temples. The tremor in his hands had increased, subtle but present. Most telling was his breathing, shallow, controlled, the pattern of someone managing pain that was escalating despite their best efforts to contain it. Colonel, she said quietly, how long have you had this pain? That's not your concern. But there was something different in his tone now, a fraction less certainty. When did it start? Cross's jaw worked. For a moment, Evelyn thought he might actually tell her. Then his pride reasserted itself, armor slamming back into place. Find me a real doctor. That's an order. Evelyn could have pressed, could have pulled rank in the only way that mattered in this space. Medical authority over patient care. Could have called security if he refused assessment. Instead, she did something that surprised even herself. She walked to the nearest chair, sat down directly across from where Cross stood swaying slightly, and simply waited. What are you doing? Cross demanded. Waiting, Evelyn replied calmly. Dr. Peterson is with a critical patient, motorcycle accident, multiple trauma. Dr. Chen is in surgery. Dr. Williams will be available in approximately 15 minutes. Until then, I'm going to sit right here and make sure you don't fall and crack your head open on this nice, clean floor we just mopped. I don't need a babysitter. No, sir, you don't. Evelyn folded her hands in her lap, her posture relaxed but her eyes never leaving him. But you're getting one anyway. The standoff lasted perhaps 30 seconds, though it felt longer. The waiting room had returned to its background murmur of pain and worry, but several patients were still watching the drama unfold. The intake nurse had retreated to her station, wisely deciding not to intervene. A resident Evelyn didn't recognize poked his head out from behind the triage curtain, assessed the situation, and apparently decided he wanted no part of it. Cross remained standing, swaying almost imperceptibly. His hand never left his thigh, fingers digging into the muscle with enough force to leave marks. Evelyn watched his breathing, counted the shallow rises and falls of his chest, noted the way sweat had begun to bead at his hairline despite the aggressive air conditioning that kept the ER at a constant 68 degrees. This is absurd, Cross muttered. But he didn't move, didn't demand again. Something in his body was overriding his pride, sending urgent signals that even his iron will couldn't completely suppress. 4 minutes passed, then 5, and Evelyn remained perfectly still, a statue of patience that seemed to unnerve Cross more than any argument could have. She'd learned this technique in another lifetime, in situations where stillness was survival, where watching and waiting could mean the difference between life and death. The skill had never left her, even after she'd traded combat boots for nursing clogs, desert sand for hospital linoleum. At minute 6, Cross's left knee buckled. It was slight, just a momentary give that he caught immediately, locking the joint with visible effort. But Evelyn saw it. She was on her feet before his pride could reassert itself, moving with a speed that contradicted her earlier stillness. "Sit down," she said, her voice carrying a tone that wasn't suggestion or request. It was the voice of someone who had given orders in situations where hesitation meant death, where authority had to be absolute and immediate. Cross's eyes widened slightly. For the first time since entering the ER, uncertainty flickered across his face. "I'm fine. You're not." Evelyn was beside him now, close enough to catch him if he went down. "Your left leg just gave out. Your breathing is shallow and rapid. You're diaphoretic, sweating, despite stable ambient temperature. And unless I'm very much mistaken, that pain you're experiencing is pulsing in rhythm with your heartbeat." Cross stared at her. "How did you—" "Sit down." Each word was a command. Now. Perhaps it was the authority in her voice. Perhaps it was the sudden spike of dizziness that made the fluorescent lights blur and swim. Perhaps it was simply that his body had reached the limit of what stubborn pride could overcome. Whatever the reason, Colonel Daniel Cross, 3-tour veteran, decorated officer, man who had once walked 5 miles on a fractured ankle to reach an extraction point, sat down heavily in the plastic chair Evelyn guided him toward. The moment he was seated, Evelyn's fingers were on his wrist, finding his pulse. Fast, thready. The rhythm irregular in a way that sent alarm bells clanging through her assessment. She pulled a pen light from her pocket. She always carried one, habit from years when equipment couldn't be counted on, and checked his pupils. Equal and reactive, but the response was sluggish. "I need a wheelchair and a triage bed," Evelyn called out, her voice carrying across the waiting room without rising to a shout. The intake nurse jumped to comply. "And page Dr. Peterson. Tell him I'm bringing in a possible vascular emergency." "Vascular?" Cross's voice had lost its sharp edge, replaced by something that might have been concern. "It's just a muscle strain from—" "When did the pain start?" Evelyn asked again, her fingers already moving to his throat to feel for carotid pulse, comparing it to the radial. The differential worried her. "This afternoon, maybe 1400 hours. But Cross's military time-telling was automatic, ingrained. "I was in a briefing and—" "Did it start suddenly or gradually?" "Suddenly. Sharp, like someone drove a spike through my thigh." He was talking to her now, really talking, the barriers of contempt temporarily lowered by the urgency in her manner. "I thought I'd pulled something, maybe a severe cramp. I've had those before from long runs." "And it's gotten worse since then?" "Yes, significantly. The admission seemed to cost him something. I took ibuprofen, iced it, tried to walk it off. Nothing helped. The wheelchair arrived, pushed by a nursing assistant Evelyn had worked with for 3 years. "Bed 4 is open," the assistant said quietly. "Perfect." Evelyn helped Cross transfer from chair to wheelchair, noting how his weight was almost dead in her hands. He was fading faster than she'd initially assessed. "Colonel, I need you to listen to me very carefully. Can you do that?" Cross nodded, his face now clearly showing the fear breaking through his military stoicism. "What's wrong with me?" "I don't know yet, but we're going to find out." Evelyn pushed the wheelchair herself, moving quickly but not running. Running in an ER caused panic, and panic spread like wildfire. "Has anyone in your family had problems with blood clots, aneurysms, vascular issues?" "My father." Cross's voice had dropped to barely above a whisper. "He died of an aortic aneurysm when he was 58. I'm 56. Everything clicked into place with sickening clarity. The sudden onset of pain, the pulsing quality synchronized with heartbeat, the location in the thigh, the family history. Evelyn's mind raced through differential diagnoses, each one more concerning than the last. Arterial dissection, pseudoaneurysm, acute compartment syndrome with vascular compromise. They reached bed 4, a small curtained area with monitoring equipment already waiting. Evelyn called out instructions as she moved. "I need a full set of vitals, 2 large-bore IVs, type and cross for 6 units, and get me portable ultrasound. Now." The resident she'd seen earlier appeared, young Dr. Marcus Chen, his expression skeptical. "Evelyn, what's going on? This patient refused triage." "Possible arterial emergency," Evelyn said, already helping Cross onto the bed. "Family history of aneurysm, sudden onset of severe thigh pain, pulsatile quality, deteriorating status over 6 hours." Chen's skepticism evaporated. "Jesus. Okay, let me examine—" "Check his femoral pulse," Evelyn interrupted. "Left side, tell me what you feel." Chen moved to comply, his fingers finding the landmark in Cross's groin. His face went pale. There's a mass. Pulsatile. And the pulse is weak compared to the right side." "Someone get Dr. Peterson out of that trauma bay," Evelyn snapped, her calm facade cracking just enough to show the urgency beneath. "This patient needs vascular surgery 5 minutes ago." Cross's hand shot out, grabbing Evelyn's wrist with surprising strength. "Am I dying?" The question hung in the air between them. Evelyn looked down at this man who had dismissed her so thoroughly just minutes ago, who had judged her worthless based on nothing but her civilian clothes and gray hair. She could have been petty, could have reminded him of his contempt, could have let him stew in his fear the way he tried to drown her in his disregard. Instead, she covered his hand with her free one and looked him straight in the eye. "Not on my watch, Colonel, but I need you to trust me now. Can you do that?" Cross's grip tightened. Then, slowly, he nodded. The next few minutes moved with the choreographed chaos that marked all true medical emergencies. The nursing assistant returned with the IV supplies. Another nurse Evelyn barely knew appeared with the ultrasound machine, its screen glowing to life as someone plugged it in. Dr. Peterson burst through the curtain, still in his trauma gown, his face a mask of controlled urgency. "Talk to me," Peterson demanded. Evelyn ran down the findings, her voice crisp and clinical. 56-year-old male, sudden onset severe left thigh pain, approximately 6 hours ago, pain described as pulsatile and worsening. Family history significant for fatal aortic aneurysm in father. On exam, palpable pulsatile mass in left groin, diminished distal pulses, patient showing signs of early shock, hypotensive at 90/60, heart rate 120, and climbing, diaphoretic, altered mental status beginning to present. Peterson was already reaching for the ultrasound probe, squirting gel onto Cross's exposed thigh. The image that appeared on screen made everyone in the curtained area go silent. "That's a femoral artery pseudoaneurysm," Peterson said quietly, almost reverently, the way doctors speak when they're looking at something that could kill in minutes. "It's huge, at least 8 centimeters, and oh God, look at that wall, it's about to rupture." Cross's voice was thin, thread. "What does that mean?" Peterson didn't sugarcoat it. "It means you have a balloon in one of your major arteries that's filled with blood and ready to pop. When it does, you'll bleed out internally in minutes. We need to get you to an OR immediately." "Call surgery." Evelyn was already moving, pushing the crash cart closer. "And get me—" She didn't finish the sentence. Cross's blood pressure alarm started screaming, the shrill tone cutting through every other sound. The monitor showed numbers dropping faster than should be possible: 80/50, 75/48, 70/45. "He's crashing," Chen said, stating the obvious because sometimes you had to name the disaster to believe it was happening. Cross's eyes rolled back. His body went rigid, then terrifyingly slack. The heart monitor showed a rhythm that made Evelyn's blood turn to ice, ventricular tachycardia, the heart beating so fast it couldn't actually pump blood, a rhythm that preceded death by seconds or minutes at most. "He's coding!" Peterson lunged for the defibrillator. "Get me EPI and charge to 200. But Evelyn was already moving, her hands finding landmarks on Cross's groin with precision that came from muscle memory decades old. She pressed down hard, both thumbs applying pressure to a point that made Dr. Chen inhale sharply. "What are you doing?" Chen demanded. "Manual compression of the femoral artery above the aneurysm," Evelyn said, her voice steady despite the adrenaline flooding her system. "If we can control the bleeding internally, we might stabilize him long enough to get him upstairs." "That's not— Nurses aren't trained," Chen sputtered. "She's right," Peterson interrupted, his hands busy with the defibrillator pads. "Keep that pressure. Don't let up for anything. The code that followed was controlled chaos. Peterson shocked Cross once, twice, the Marine's body jerking with each jolt of electricity. Someone, Evelyn thought it might be the intake nurse who'd initially been too scared to intervene, was doing chest compressions with the mechanical rhythm of good CPR training. Another nurse pushed medications through the IV, calling out each one as it went in. And through it all, Evelyn maintained her pressure on Cross's femoral artery, her thumbs aching with the force required to compress the vessel against bone. She could feel his pulse beneath her fingers, weak, thready, but present. The pseudoaneurysm was a time bomb ticking beneath his skin, and she was the only thing keeping it from detonating. "I've got a rhythm," Peterson announced, and the monitor confirmed it. Sinus tachycardia, fast but organized, a heartbeat that could actually sustain life. Blood pressure's coming up, 90/60, 100/65. Cross's eyes fluttered open, consciousness returning in confused fragments. "What?" "Don't move," Evelyn ordered, her thumbs never shifting from their position. "Stay absolutely still, Colonel. Do you understand me?" Cross's gaze found hers, and in his eyes she saw the recognition finally dawning. Understanding, gratitude, and something that might have been shame. "You saved my life." "Not yet," Evelyn corrected, "but we're working on it." The vascular surgeon arrived like a small tornado doctor. Sarah Kim moving with the confidence of someone who'd repaired blown arteries in conditions ranging from pristine operating theaters to field hospitals in war zones. She took one look at the ultrasound, one look at Evelyn's hand position, and nodded once. "Good call on the manual compression. How long have you been holding it?" Evelyn glanced at the wall clock. 4 minutes. "Can you maintain for another 2? We need to get him upstairs, but I want him as stable as possible before we move." "I can hold it as long as you need." Kim's eyes narrowed slightly, professional assessment taking in details most people missed. "You've done this before. Manual arterial compression isn't standard civilian nursing protocol." "I've done a lot of things before," Evelyn replied neutrally. The statement hung in the air, laden with unspoken history. But there was no time for questions, no space for explanations. Kim turned to Peterson. "Let's move. I want him in OR2 in 5 minutes. Have anesthesia standing by and make sure we have vascular grafts ready. I'm probably going to need to replace a section of that artery." The transfer was a carefully coordinated dance. Evelyn maintained her compression as they moved Cross from ER bed to transport gurney. Her arms screamed with the effort, muscles burning from the sustained pressure, but she didn't let up. Couldn't let up. One slip, one moment of weakness, and the pseudoaneurysm would rupture. Cross would bleed out before they could even reach the elevator. They moved through the ER hallway, past the waiting room where patients still sat with their comparatively minor injuries, past the triage desk where the young intake nurse watched with wide eyes, past the security station where a guard held the elevator doors open, having been radioed ahead to clear the path. In the elevator, with just Evelyn, Cross, Peterson, and 2 other nurses crammed into the small space, Cross spoke again. His voice was weak but clear. "I was wrong about you." Evelyn kept her eyes on her hand position, checking to make sure the pressure remained constant despite the elevator's movement. "Sir, you don't need to—" "I do need to." Cross's words came with visible effort, each syllable a fight against pain and medication and the simple exhaustion of his body trying to keep itself alive. "I judged you, dismissed you, called you things." He trailed off, shame coloring his pallor. "You were in pain and scared," Evelyn said simply. "People say things they don't mean when they're scared." "That's generous." Cross managed something that might have been a laugh if he'd had the breath for it. "More generous than I deserve," said. The elevator doors opened onto the surgical floor. The team was waiting. Anesthesiologist, surgical nurses, techs with equipment already prepared. Dr. Kim appeared, already scrubbed, her face visible above her surgical mask. "Okay, Nurse Ward, we're going to transfer him to the OR table on 3. I need you to maintain that compression through the transfer and hold it until I'm ready to take over. Can you do that?" "Yes, doctor." The transfer was smooth, practiced. One moment Cross was on the transport gurney, the next he was on the surgical table, lights blazing overhead, instruments gleaming in sterile rows. Evelyn's hands never moved. Her pressure never faltered. She was vaguely aware of her arms trembling now, muscles at their limit after nearly 8 minutes of sustained compression. Dr. Kim's gloved hands moved into position beside Evelyn's. I'm going to place a clamp above your compression point. When I tell you, I need you to release pressure gradually. Don't just let go. Understand? Understood. Ready? Now. Slowly. Evelyn eased off the pressure fraction by fraction, feeling Kim's clamp take over the work her thumbs had been doing. The transition was seamless, a perfect handoff between providers who understood the stakes. Good, Kim said. Perfect. You can step back now. Evelyn's arms dropped to her sides, suddenly leaden and useless. One of the OR nurses, a woman Evelyn recognized but couldn't name, gently guided her toward the door. You did great. Let them take it from here. But Evelyn paused at the threshold, looking back at Colonel Cross on the table. His eyes were closed now, anesthesia pulling him under for the surgery that would either save his life or confirm that she'd only bought him temporary time. As if sensing her gaze, his eyes fluttered open one more time. Thank you, he mouthed, the words inaudible behind his oxygen mask. Evelyn nodded once. Then she stepped through the OR doors and into the hallway, where Dr. Peterson was waiting. That was incredible work in there, Peterson said. How did you know to experience? Evelyn interrupted, suddenly exhausted beyond measure. Is there anything else you need from me? I should get back to the ER. Peterson studied her for a long moment, questions clearly forming, but he must have seen something in her face that warned against pushing. No, that's all. I'll update you when he's out of surgery. Evelyn walked back to the elevator, her arms still trembling, her mind replaying every second of the last 20 minutes. She'd saved a man's life tonight, a man who had looked at her and seen nothing but a washed-up civilian not worth his time. A man who had learned, perhaps too late but hopefully not, that competence came in many forms and dignity was earned through action, not assumption. The elevator doors closed, and Evelyn leaned against the wall, finally allowing herself to feel the bone-deep weariness of adrenaline crash. Her scrubs were stained with Cross's sweat and blood. Her hands ached. Her back protested the sustained awkward position she'd held while maintaining compression. But she'd done it. She'd seen what others missed, acted when others hesitated, and held the line when holding the line was all that stood between life and death. She'd done exactly what she'd been trained to do in another life, in another uniform, when holding the line meant everything, and failure meant death. The elevator descended, carrying her back to the emergency department where other patients waited, other crises loomed, other chances to prove that she was exactly as qualified as she'd ever been. She just didn't know yet that saving Colonel Daniel Cross's life would cost her everything she'd worked 6 years to build. That reckoning was waiting for her, patient and inevitable, in the morning that would follow. The ER had returned to its usual rhythm by the time Evelyn stepped back through the double doors. The teenager with the basketball injury was being wrapped in an ace bandage. The elderly woman had been taken back for imaging. A new wave of patients had arrived, a child with croup, a man complaining of chest pain, a woman who'd sliced her hand open while cooking dinner. Life continued, crisis by crisis, each one demanding attention and care. Evelyn moved to the sink and scrubbed her hands, watching Cross's blood swirl down the drain in pink-tinged water. Her arms still trembled slightly, the muscle fatigue a reminder of those 8 minutes that had stretched like hours. She dried her hands and returned to the nurse's station, picking up the chart for her next patient. That was insane! The intake nurse, her name tag read Jessica, appeared at Evelyn's elbow, eyes still wide with residual adrenaline. I've never seen anyone do what you just did. The way you just knew what was wrong, and then the compression thing. I didn't even know nurses could do that. In emergencies, you do what needs to be done, Evelyn said simply, not looking up from the chart. Is the chest pain in Bay 6 cardiac or anxiety? Jessica blinked at the subject change. Probably anxiety? His EKG was normal and probably isn't good enough. Run a troponin and keep him on the monitor for another hour. Evelyn handed back the chart. Better to be cautious. The night progressed. Evelyn triaged, assessed, administered medications, held hands, explained diagnoses in language patients could understand. She was good at her job, had always been good at it, and she lost herself in the familiar rhythm of emergency nursing. It was nearly midnight when Dr. Peterson found her in the supply room, restocking her pockets with alcohol swabs and gauze. "He's out of surgery," Peterson said without preamble. Dr. Kim said it was touch and go for a while. The pseudoaneurysm had already started to rupture when she opened him up. Another 5 minutes, and he would have bled out on the table. Evelyn's hands stilled on a package of 4x4s. "But he's stable now?" "Stable and in recovery." Kim replaced a 12-centimeter section of his femoral artery with a graft. She said if you hadn't compressed it when you did, there's no way he would have made it to the OR alive. Peterson leaned against the doorframe, his expression thoughtful. "She also said the technique you used, the specific hand position and pressure point, isn't something they teach in civilian nursing programs. She wanted to know where you learned it." The question hung in the air between them. Evelyn resumed her restocking, her movements deliberate and calm. "I've had a lot of training over the years." "That's not an answer, Evelyn." "It's the only answer I'm giving tonight." She closed the supply cabinet and turned to face him. "The patient is alive. That's what matters." Peterson studied her for a long moment, and Evelyn could see the curiosity warring with respect for her privacy. Finally, he nodded. "Fair enough. But you should know. Cross is asking for you. He wants to thank you personally." "He doesn't need to do that." "Maybe not, but he wants to." Peterson pushed off from the doorframe. "I told him you'd stop by when your shift ends. Recovery room, bed 12. Evelyn's shift ended at 6 a.m., the thin gray light of dawn just beginning to seep through the hospital windows. She was exhausted in the way that only a full night in the ER could create. A bone-deep weariness that came from constant vigilance, from making split-second decisions that meant life or death, from absorbing the fear and pain of dozens of strangers and trying to transform it into something manageable. She should have gone straight to her car, driven home to her small apartment, collapsed into bed for the 6 hours before her next shift. Instead, she found herself climbing the stairs to the recovery floor, her feet carrying her almost against her will. The recovery room was quiet, most patients still sleeping off anesthesia. Bed 12 was in the corner, partially curtained off. Colonel Daniel Cross lay propped up at a 45-degree angle, an IV in his arm, monitors beeping softly. His dress uniform had been replaced by a hospital gown, the great equalizer that made even decorated Marines look vulnerable. His eyes were open. When he saw Evelyn approach, something shifted in his expression. Relief, gratitude, and unmistakable shame all mixing together. "Nurse Ward," his voice was hoarse from intubation. "I wasn't sure you'd come." "Dr. Peterson said you wanted to see me." Evelyn remained standing, professional distance maintained. "How are you feeling?" "Like someone cut into my leg and replaced part of my artery." A ghost of a smile. "Which is exactly what happened, so I suppose that's accurate." The smile faded. "I owe you my life." "You don't owe me anything, Colonel. I was doing my job." "No." Cross shifted slightly, wincing at the movement. "You did more than your job. You saved a man who treated you with contempt, who questioned your competence, who was so blinded by his own prejudice that he couldn't see what was right in front of him." Evelyn said nothing, simply waited. She'd learned long ago that silence often said more than words ever could. Cross continued, the words seeming to come with effort that had nothing to do with physical pain. "I've spent my entire career leading Marines. I pride myself on being able to assess people, to see their capabilities, to know who can be trusted in crisis situations. And yet when it mattered most, I was completely wrong about you." He paused. "The way you moved in that ER, the certainty, the precision, the command presence. That wasn't civilian nursing training. I've worked with enough combat medics to recognize the difference." "Ancient history," Evelyn said quietly. "Is it?" Cross's gaze sharpened despite the lingering effects of anesthesia. "Dr. Kim said the technique you used to compress my femoral artery is something she only learned during her deployment to Afghanistan. She said it's a field expedient measure used when there's no time for proper surgical intervention, when the choice is between improvisation and death." His eyes never left Evelyn's face. "Where did you serve?" The question was direct, unapologetic. Evelyn could have deflected again, could have maintained her privacy the way she'd done for 6 years. But something about the directness, the genuine curiosity stripped of earlier contempt, made her answer. Iraq. First tour in 2004, second in 2006, third in 2008. The words came out flat, factual. I was a Navy surgical nurse attached to a Marine combat unit. We ran a forward surgical team in Fallujah. Cross's expression shifted to something approaching reverence. Fallujah, 2004. He didn't need to say more. Everyone who'd served knew what Fallujah meant. The grinding urban combat, the casualties that came in waves, the surgery performed in conditions that would have shut down civilian hospitals. I did my job, Evelyn said again. Same as everyone else. No, not the same. Cross's voice carried absolute certainty. I've read the after-action reports from Fallujah. The surgical teams there performed miracles on a daily basis. They saved Marines who had no business surviving, who would have died in any other war, in any other circumstance. He paused. Why didn't you tell me? When I was dismissing you, questioning your experience, why didn't you say something? Evelyn considered the question. Would it have mattered? You'd already decided who I was based on what you saw. My resume wouldn't have changed your mind. You're right. The admission seemed to cost him something. It wouldn't have. I was too busy being an arrogant ass to listen. He shifted again, and this time the wince was more pronounced. For what it's worth, I'm sorry. Genuinely and completely sorry. Apology accepted. Evelyn moved to check his IV, professional habit, overriding the personal conversation. The drip rate was correct, the insertion site clean. You should rest. Dr. Kim will want to see how you're doing when she makes rounds. Wait. Cross's hand moved toward her, not quite touching, but the gesture clear. There's something else. I need to ask you something, and I need you to be honest with me. Evelyn waited. In the ER, when I was coding, I remember fragments. I remember you doing the compression, but there was something else. Something about the way everyone reacted to what you were doing. Dr. Chen seemed shocked, like you'd done something unexpected. Cross's gaze was steady. What aren't you telling me? Evelyn could have lied, could have minimized. Instead, she met his gaze with equal steadiness. The manual arterial compression I performed isn't a standard civilian nursing intervention. It requires anatomical knowledge and physical skill that most nurses don't have. It also carries significant liability risks. If done incorrectly, it can cause more harm than good. Hospital protocols generally don't authorize nurses to perform that procedure without direct physician supervision. But you did it anyway. You were dying, Colonel. Protocol doesn't matter much when someone's dying. Cross absorbed this, his expression thoughtful. So you broke the rules to save my life. I did what needed to be done. That's not quite the same thing, is it? Cross settled back against his pillows, exhaustion beginning to claim him. Thank you, Nurse Ward, for my life, for your skill, and for your grace in the face of my ignorance. Evelyn nodded once and turned to leave. She was almost to the curtain when Cross spoke again, his voice already fading towards sleep. Whatever happens because of what you did, I'll make sure the truth is known. I promise you that. The words sent a small chill down Evelyn's spine, but she dismissed it. Cross was medicated, exhausted, speaking from gratitude rather than knowledge. Nothing was going to happen. She'd saved a patient's life using skills she'd learned in service to her country. The hospital would understand. They'd have to. She drove home as the sun rose over Portland, the city slowly waking to another ordinary Saturday. Her apartment was small but comfortable, a one-bedroom in a quiet neighborhood, decorated minimally because she'd never quite shaken the military habit of traveling light. She showered, washing away the last traces of the night's emergency, and fell into bed. Sleep came quickly, deep and dreamless. When she woke 6 hours later, she had 3 missed calls and 2 voicemails, all from the hospital administrative office, all marked urgent. The first voicemail was from Margaret Hutchins, the ER nursing director. Her voice was tight, professional, carefully neutral. Evelyn, this is Margaret. I need you to call me back as soon as you get this message. It's regarding last night's incident with the vascular patient. Please don't come in for your shift tonight until we've had a chance to talk. The second voicemail was from someone Evelyn didn't know, Richard Brennan, Assistant Director of Risk Management. His message was even more ominous in its brevity. Ms. Ward, this is Richard Brennan from Risk Management. You are required to attend a meeting in my office Monday morning at 8 a.m. regarding a serious protocol violation. This meeting is mandatory. Do not discuss this matter with other staff members before the meeting. Evelyn sat on the edge of her bed, phone in hand, the words echoing in her mind. Protocol violation, risk management, mandatory meeting. The pieces fell into place with sickening clarity. She'd saved Colonel Cross's life, and now she was going to be punished for it. The weekend stretched ahead, each hour a slow torture of waiting and wondering. Evelyn called Margaret back and got voicemail. The nursing director was conveniently unavailable. She considered calling Peterson, but Brennan's instruction not to discuss the matter held her back. Instead, she spent Saturday afternoon researching, pulling up hospital policies on nursing procedures, reviewing state regulations on scope of practice, reading through the employee handbook she'd signed 6 years ago. The manual arterial compression fell into a gray area. It wasn't explicitly prohibited, but it also wasn't explicitly authorized for nurses without physician supervision. The fact that Dr. Peterson had been present during the code should have covered her, but the compression had been initiated before Peterson gave any orders. She'd acted on her own assessment, her own authority, using skills that technically fell outside standard nursing practice. By Sunday evening, Evelyn had drafted and discarded 3 different written statements explaining her actions. None of them felt right. The truth was simple. She'd seen a patient dying, and she'd done what needed to be done to keep him alive until surgery could save him. But simple truths had a way of becoming complicated when lawyers and administrators got involved. Monday morning arrived cold and gray, rain spattering against Evelyn's windshield as she drove to the hospital. She'd dressed carefully, professional but not formal, her scrubs replaced by slacks and a blazer. She arrived 15 minutes early and sat in her car, watching the minute hand crawl toward 8 o'clock. The risk management office was on the 3rd floor, tucked away in a corner that most clinical staff never visited. Evelyn knocked at precisely 8 and was immediately shown into a conference room. Richard Brennan sat at the head of the table, a thin man in his 50s with wire-rimmed glasses and an expression that suggested chronic indigestion. Beside him sat Margaret Hutchins, who wouldn't meet Evelyn's eyes. 2 other people Evelyn didn't recognize occupied the remaining chairs, both with legal pads and the predatory alertness of lawyers. Ms. Ward, thank you for coming. Brennan's voice matched his appearance, dry, precise, vaguely disapproving. Please, sit down. Evelyn sat, folding her hands in her lap with a calmness she didn't feel. Brennan opened a folder in front of him. I'm sure you know why you're here. On Friday night, you performed a medical procedure that falls outside the scope of standard nursing practice. Specifically, you performed manual compression of a patient's femoral artery without direct physician authorization and prior to any emergency orders being given. I performed a life-saving intervention on a coding patient, Evelyn corrected quietly. Dr. Peterson was present and endorsed my actions immediately. After the fact, one of the lawyers spoke up, a woman with severe features and an even more severe tone. You initiated the procedure on your own authority. The patient was in ventricular tachycardia. He was seconds from full cardiac arrest. There wasn't time for a committee discussion. Nevertheless, Brennan continued, as if Evelyn hadn't spoken, your actions exposed this hospital to significant liability. If your intervention had failed, if you'd caused additional harm, if the patient had died anyway, Riverside General would have been legally responsible for a nurse performing procedures she wasn't authorized to perform. But he didn't die, Evelyn said, her voice still calm despite the anger beginning to simmer beneath the surface. He's alive and recovering because of what I did. That's not the point. Margaret finally spoke, her voice heavy with something that might have been regret. Evelyn, you're an excellent nurse. Everyone knows that. But you can't just improvise in emergency situations. We have protocols for a reason. We have scope of practice guidelines for a reason. The reason is to protect patients, Evelyn said, which is exactly what I did. The reason, the male lawyer interjected, is to protect the hospital from litigation and liability exposure. Your actions, however well-intentioned, violated multiple hospital policies and potentially violated state nursing practice acts. Brennan cleared his throat. Ms. Ward, we've reviewed your personnel file. Your record here has been exemplary. No complaints, excellent evaluations, strong relationships with physicians and staff, which is why we're prepared to be lenient in this situation. The word lenient sent ice through Evelyn's veins. You're being placed on immediate administrative leave while we conduct a full investigation into Friday night's incident, Brennan continued. The investigation will examine whether your actions constituted practicing outside your scope, whether appropriate physician supervision was present, and whether the hospital's policies and procedures were adequately followed. How long will this investigation take? Evelyn's voice had gone very quiet. Typically 2 to 4 weeks. During that time, you will not be permitted on hospital grounds, except for official meetings related to the investigation. You will continue to receive your base pay, but you are not to discuss this matter with other staff members. I'm being punished for saving a patient's life. Evelyn stated it as fact, not question. You're being held accountable for violating hospital policy, Brennan corrected. There's a difference. Is there? Evelyn stood, her chair scraping against the floor. Colonel Cross is alive right now because I had the training and the skill to do what needed to be done. If I'd waited for authorization, if I'd followed protocol exactly, he would be dead. Are you telling me that following procedure matters more than a patient's life? Margaret's expression crumpled slightly. Evelyn, please, don't make this harder than it has to be. How am I making this hard? I did my job. I saved a man's life, and now I'm being suspended for it. Evelyn looked around the table, meeting each person's eyes in turn. Is there anything else you need from me, or am I dismissed? Brennan's jaw tightened. We'll be in touch as the investigation proceeds. You'll receive written notification of any hearings or additional meetings. In the meantime, please leave your badge and keycard with security on your way out. The walk to the security office felt endless. Evelyn handed over her hospital ID badge, the one with her photo from 6 years ago, when she'd first started at Riverside, when she'd thought maybe she could build a new life separate from her military past. The security guard, an older man named Tom who always had a kind word when she worked night shift, took the badge with obvious discomfort. I'm sorry, Evelyn, he said quietly. This doesn't seem right. Thank you, Tom. She walked out through the main entrance, past the ER where she'd worked hundreds of shifts, past the trauma bays where she'd fought for countless lives. The rain had intensified, cold drops soaking through her blazer before she made it to her car. She sat in the driver's seat, hands gripping the steering wheel, the full reality of the situation finally hitting her. She was suspended, under investigation, her nursing license potentially at risk, all because she'd saved a man's life using skills that were deemed inappropriate for someone with her credentials. The unfairness of it burned like acid. She'd spent years in combat zones, had performed emergency medicine under conditions that would have paralyzed most civilian providers, had earned decorations and commendations for her service. She'd left the military to escape the politics and the bureaucracy, to focus on patient care in an environment where healing mattered more than hierarchy. And yet here she was, being punished by a different kind of bureaucracy, one that valued procedure over patience and liability over life. Evelyn started the car and drove home through the rain, her mind already turning over options. She could fight this, could get a lawyer, could push back against the investigation, could make noise about how wrong this was. But fighting meant publicity, meant attention, meant people digging into her background and asking questions she'd spent 6 years avoiding. Or she could accept it, could let the investigation proceed, could hope that cooler heads would prevail, that someone would recognize the absurdity of punishing a nurse for saving a patient's life. She was still wrestling with the decision when she pulled into her apartment parking lot and saw the black sedan parked in front of her building. Military plates. A uniformed Marine standing beside the driver's door, rain beating on his pristine cover. Evelyn's heart sank. She parked and walked over, recognizing the insignia of a staff sergeant. Nurse Ward? The Marine's voice was respectful, almost reverent. I'm Staff Sergeant Michael Torres. Colonel Cross sent me to find you. He heard about what happened at the hospital this morning. How did he... Evelyn stopped. Of course Cross had heard. Military intelligence networks made civilian gossip chains look amateur. The colonel would like to speak with you, ma'am. If you're willing. Evelyn looked at the staff sergeant, at the sedan with its military plates, at the whole situation spinning further and further beyond her control. She thought about saying no, about maintaining her distance, about handling this quietly on her own the way she'd handled everything else for 6 years. Instead, she heard herself say, "Where is he?" Walter Reed Army Medical Center. He had himself transferred this morning. He said, Torres paused, choosing his words carefully. He said you saved his life, and now it's his turn to save yours. Ma'am, the colonel wants to help. Will you let him? The rain continued to fall, cold and relentless. Evelyn stood on the edge of a decision that would either vindicate her or destroy the careful anonymity she'd built. She thought about Colonel Cross's promise in the recovery room. Whatever happens because of what you did, I'll make sure the truth is known. She thought about the administrators in that conference room, more concerned with liability than life. She thought about every patient she'd ever saved, every life she'd fought for, every moment when doing the right thing had mattered more than following the rules. Yes, Evelyn said finally. I'll let him help. Torres opened the sedan's rear door, and Evelyn climbed inside, the decision made. She didn't know yet what Colonel Cross had planned, didn't know how his intervention might complicate or resolve her situation. She only knew that she was done being silent about who she was and what she'd done. The sedan pulled away from her apartment complex, heading toward whatever came next, and Evelyn felt something she hadn't felt in 6 years, the strange, terrible, liberating sensation of going back to war. The drive to Walter Reed took 3 hours through rain that never let up, the wipers beating a monotonous rhythm against the windshield. Staff Sergeant Torres drove with the focused silence of military discipline, occasionally glancing in the rearview mirror but never initiating conversation. Evelyn sat in the back seat, watching the landscape blur past, her mind cycling through scenarios and consequences. By accepting Cross's help, she was making a choice. Not just about this investigation, not just about her job at Riverside General, but about the person she'd been trying to become for 6 years. She'd left the Navy, left the combat zones, left the identity of Lieutenant Commander Evelyn Ward behind because she'd thought she could build something different, something quieter, a life where her past didn't define every interaction, where she could simply be a nurse helping patients without the weight of service record and combat decorations coloring every perception. But maybe that had always been impossible. Maybe some things couldn't be left behind no matter how far you ran or how thoroughly you buried them. The sedan passed through Walter Reed's main gate, the guard waving them through after a brief check of Torres's credentials. The medical center sprawled across the grounds, a complex of buildings that housed some of the military's most advanced medical care. Torres pulled up to the main hospital entrance and came around to open Evelyn's door. Colonel Cross is in the VIP wing, 4th floor, Torres said. I'll wait here for you, ma'am. The 4th floor was quiet, reserved for high-ranking officers and dignitaries. A nurse at the station looked up as Evelyn approached, her expression shifting from professional courtesy to something warmer when Evelyn gave her name. Oh, Nurse Ward, the colonel said you'd be coming. He's been asking about you every hour. The nurse, her name tag read Captain Sarah Mitchell, gestured down the hallway. Room 412. Fair warning, he's got half the Marine Corps brass on speed dial, and he's been using it. Evelyn found Cross sitting up in bed, looking far more alert than any patient 3 days post-op had a right to look. His laptop was open on the bedside table, and he had a phone pressed to his ear. When he saw Evelyn in the doorway, he held up one finger in a wait gesture. I don't care what the hospital's legal counsel says, General. One of our own is being persecuted for doing exactly what we trained her to do. Cross's voice carried the steel of command despite his patient status. Yes, sir, I understand. Thank you, sir. He ended the call and set the phone aside. Nurse Ward, thank you for coming. Staff Sergeant Torres said you wanted to help. Evelyn remained standing, maintaining the distance of uncertainty. Colonel, I appreciate the gesture, but I'm not sure what you think you can do. This is a civilian matter, hospital administration, and it stopped being purely civilian the moment they suspended a decorated combat veteran for using skills she learned saving Marines under fire. Cross's interruption was sharp, definitive. Sit down, please. We need to talk strategy. Evelyn sat in the visitor's chair, noting the way Cross had already transformed the hospital room into a command center. Papers were stacked on the bedside table. His laptop showed what looked like email correspondence, and a leather folder embossed with the Marine Corps emblem sat within easy reach. "I made some calls," Cross began, starting with my own chain of command, then branching out. "You've caused quite a stir, Nurse Ward." "I saved your life. That caused a stir?" "No. The fact that a Navy nurse with a Silver Star and 2 Bronze Stars for valor is being suspended for doing her job, that caused a stir." Cross opened the leather folder and pulled out a document. "I had someone pull your service record. Do you know what I found?" Evelyn's jaw tightened. That was confidential. Was being the operative word. Lieutenant Commander Evelyn Ward, Navy Nurse Corps, 3 deployments to Iraq, assigned to 1st Marine Division Surgical Team, Fallujah, 2004 through 2008, commended for performing emergency surgery under direct enemy fire on 14 separate occasions, credited with saving 47 lives during the Second Battle of Fallujah alone. Cross looked up from the document. "The Silver Star citation is particularly impressive. You performed a field amputation on a Marine with a traumatic injury, kept him alive for 6 hours through sustained combat, then personally carried him to the evacuation point when your corpsman was killed. That was a long time ago." Evelyn's voice was flat, emotionless. "I left that life behind." "Did you? Because from where I'm sitting, you're still doing exactly what you did in Fallujah, saving lives regardless of the cost to yourself." Cross set the document aside. "Why did you leave the Navy? Your record shows you were on track for promotion to captain. You could have run a major military hospital by now." Evelyn was silent for a long moment. The memories she'd spent 6 years trying to compartmentalize threatened to surface: the heat and dust of Fallujah, the endless stream of casualties, the sound of mortars impacting close enough to shake surgical instruments off their trays, the faces of Marines she'd saved and Marines she'd lost, the exhaustion that went beyond physical, that ate at your soul until you couldn't remember what it felt like to sleep without nightmares. "I was tired," she said finally. "Tired of war. Tired of triage decisions where you chose who lived and who died based on resources you didn't have. Tired of being strong all the time." She met Cross's eyes. "I wanted to be a nurse again. Just a nurse. Not a decorated hero, not a symbol, not someone's inspiration. Just someone who helped people without all the other weight." "And how's that working out for you?" The question was blunt, almost cruel in its directness. Evelyn felt anger flash through her, hot and immediate. "Before Friday night, it was working fine." "Was it?" Cross's expression was skeptical. "You've been hiding who you are for 6 years, letting people underestimate you, dismiss you, treat you like you're less than what you are. I did it myself. Looked at you in those faded scrubs and saw exactly what I expected to see. A middle-aged civilian nurse past her prime." He paused. "That must have happened a lot over the years." "I didn't need their validation." "No, but you deserve their respect." Cross shifted in the bed, wincing slightly at the pull of surgical incisions. "Here's what's going to happen. Riverside General is going to complete their investigation, and they're going to find exactly what they expect to find: that you violated protocol, acted outside your scope of practice, created liability exposure. They'll probably terminate you to protect themselves from potential lawsuits." "I know." Evelyn had already reached that conclusion during the sleepless Sunday night. "Unless we change the narrative." Cross tapped the laptop screen. "I've been coordinating with the Navy Nurse Corps, the Marine Corps Public Affairs Office, and a few well-placed contacts in medical advocacy organizations. We're going to make your case public." Evelyn's stomach dropped. "No, absolutely not. I don't want publicity. I don't want attention. What you want and what you need are 2 different things." Cross's voice carried the weight of command, the tone that expected obedience. "Right now, Riverside sees you as a liability. We're going to make you a hero. We're going to tell the story of a decorated combat nurse who saved a Marine's life using skills she learned in service to her country. We're going to make it impossible for them to fire you without looking like they're persecuting a veteran. That's manipulation. That's tactics." Cross's expression softened slightly. "Evelyn, I promised you I'd make sure the truth was known. This is how we do that. Not by fighting their investigation quietly, not by hoping bureaucrats will suddenly develop common sense. We fight by controlling the story, by making them understand exactly who they're dealing with. And if I say no, then you'll lose your job, probably lose your license, and spend the next few years trying to rebuild a career that will always have this suspension on your record. Cross's bluntness was unrelenting. Is that really what you want? To let them win because you're too proud to accept help? The words stung because they were true. Evelyn had spent 6 years defining herself by what she wasn't. Not military, not decorated, not special. Just a nurse doing her job. But that identity had been built on a foundation of denial, of deliberately obscuring her capabilities to avoid exactly the kind of attention Cross was now proposing. I need to think about this, Evelyn said quietly. You have until tomorrow morning. That's when my public affairs contact is scheduling the press conference. You already scheduled it? Evelyn's voice rose despite her attempt to remain calm. Without asking me? I'm asking you now, giving you the choice to stand up and be counted, or to stay silent and let them destroy you. Cross's gaze was steady, uncompromising. I owe you my life, Evelyn. I'm not going to sit here and watch them take yours apart because you were too good at your job. Evelyn stood abruptly, the chair scraping against the floor. I need air. She walked out of the room without waiting for a response, her heart pounding with a mixture of anger and fear, and something that might have been hope. The hallway felt too small, the walls pressing in. She found a stairwell and climbed, emerging onto the roof where a small patio area provided space for staff breaks. The rain had stopped, leaving everything wet and glistening. Evelyn stood at the railing, looking out over the medical complex, her mind churning through options and consequences. Cross was right about the investigation's likely outcome. Hospital administrators didn't care about moral victories or saved lives when legal liability was on the line. They'd sacrifice her to protect the institution, would write it off as unfortunate but necessary. But going public meant something else entirely. It meant stepping back into the identity she'd left behind, meant accepting the label of hero when all she'd ever wanted was to be ordinary. It meant every interaction from that point forward would be colored by her service record, her decorations, her past. People would either elevate her beyond reason or resent her for the attention. There would be no quiet anonymity, no simple existence as just another nurse doing her job. Thought I might find you up here. Evelyn turned to find Captain Mitchell, the nurse from the 4th floor station, standing in the doorway. The captain was younger, maybe early 30s, with the bearing of someone who'd seen combat herself. Sorry, I just needed some space to think, Evelyn said. I get it. Colonel Cross can be, intense. Mitchell moved to the railing beside Evelyn. For what it's worth, what they're doing to you is bullshit. Complete bullshit. You heard about that? Everyone in military medicine has heard about it by now. Decorated Navy nurse suspended for saving a Marine using combat medical techniques? Mitchell shook her head. It's spreading through the networks like wildfire. You've got people pissed off from here to San Diego. Evelyn absorbed this, the realization that her situation had already escaped her control. I just wanted to do my job. Yeah, well, sometimes doing your job means standing up and fighting back. Mitchell pulled out her phone and showed Evelyn the screen. It displayed a news article from a military medical journal's website. Veteran nurse faces suspension after life-saving intervention. How did they? Evelyn started. Colonel Cross has connections, and he's using every single one of them. Mitchell pocketed her phone. Look, I don't know you, but I know your type. I've worked with nurses like you, the quiet, competent ones who don't need recognition, who just want to care for patients without drama. But sometimes the drama finds you anyway. When it does, you can either curl up and take it, or you can fight back. I don't want to be a symbol. Too late. You already are. You. Mitchell's voice was gentle but firm. The question is whether you're going to let other people define what that symbol means, or if you're going to control the narrative yourself. The words echoed Cross's earlier argument, coming from a different perspective but reaching the same conclusion. Evelyn looked out over the medical complex again, watching lights blink on as evening approached. Somewhere in those buildings, other nurses were doing their jobs, triaging patients, administering medications, saving lives. Most of them would never face what she was facing, would never have their competence questioned or their license threatened for doing exactly what they were trained to do. But some would. And if she stayed silent, if she let Riverside's investigation proceed unchallenged, she'd be setting a precedent that said hospitals could punish nurses for saving lives as long as they violated protocol in the process. "When's this press conference supposed to happen?" Evelyn asked quietly. "Tomorrow at 1000 hours. Naval Medical Center, Portsmouth. They're bringing in representatives from the Navy Nurse Corps, Marine Corps brass, and several veteran advocacy groups." Mitchell paused. "Colonel Cross is planning to be there, even if his doctors have to bring him in a wheelchair." Evelyn closed her eyes briefly, feeling the weight of the decision settling onto her shoulders. She could still say no, could refuse to participate, could handle this quietly through lawyers and administrative channels, could preserve what remained of her anonymity. Or she could do what she'd always done when the stakes were high and the choices were hard. She could step forward and fight. "Tell the colonel I'll be there," Evelyn said. The next morning arrived too quickly. Evelyn had spent the night in guest quarters at Walter Reed, lying awake and rehearsing potential statements, imagining worst-case scenarios, trying to prepare herself for what was coming. At 0700, Captain Mitchell appeared with a fresh set of navy dress blues. "Colonel Cross thought you might want these," Mitchell said, laying the uniform on the bed. "They're your size." He had someone pull them from storage at the Naval District Washington office. Evelyn stared at the uniform, her hands trembling slightly as she touched the fabric. She hadn't worn navy dress blues in 6 years, had deliberately left them packed away in a storage unit, another piece of a life she'd thought she was leaving behind. "I'm not active duty anymore," Evelyn said. "No, but you're retired with honor. You have every right to wear that uniform, especially when you're being attacked for using skills the Navy taught you." Mitchell's voice was firm. "Colonel Cross said to tell you that if you're going to fight, you should fight in the uniform you earned." Evelyn dressed slowly, each piece of the uniform a step back in time. The white shirt, crisp and starched. The black tie, knotted precisely. The blue jacket with its gold buttons and shoulder board showing her rank. The ribbons mounted perfectly above the left breast pocket. Rows of colored fabric that represented years of service. Deployment survived, lives saved. When she looked in the mirror, she barely recognized herself. The woman staring back wasn't the faded, dismissed civilian nurse Riverside General had suspended. This was Lieutenant Commander Evelyn Ward, Navy Nurse Corps, decorated combat veteran. This was the person she'd been before she'd decided to hide. The drive to Portsmouth took an hour. Staff Sergeant Torres drove again, this time with Colonel Cross in the passenger seat, against medical advice but determined to be present. Cross was in his dress uniform as well, ribbons gleaming, the brass gleaming despite the visible pain he was clearly managing. "You look good," Cross said, glancing back at Evelyn, "like you belong. I haven't worn this in a long time. It remembers you anyway." Cross shifted carefully, favoring his surgical leg. "There's going to be media there, probably a lot of it." The Marine Corps Public Affairs Office reached out to several outlets, framed it as a story about veteran healthcare workers being persecuted. They jumped on it. What do I say? The truth. Nothing more, nothing less. Cross's voice was steady, calm. "Tell them what happened in that ER. Tell them about your training, your service, your experience. Let them see who you really are." The Naval Medical Center Portsmouth was already surrounded by news vans when they arrived. Evelyn counted at least 6 different stations, plus what looked like national network affiliates. Her stomach clenched with anxiety, but she forced herself to breathe through it. She'd faced worse than cameras. She'd performed surgery while mortars landed close enough to shower her with debris. She could handle a press conference. Inside, a conference room had been set up with a podium, microphones, and rows of chairs rapidly filling with reporters. Military personnel lined the walls. Navy nurses, Marine officers, representatives from veteran organizations. Evelyn recognized several faces from her deployments, people she'd served with who had somehow gotten word and shown up to support her. A Navy captain approached. Captain Elizabeth Torres, director of the Navy Nurse Corps. "Lieutenant Commander Ward, it's an honor to finally meet you. I've read your service record. It's extraordinary." "Thank you, ma'am. What Riverside General is doing to you is unacceptable. We're going to make that very clear today." Torres gestured to the podium. I'll make opening remarks, then Colonel Cross will speak, then you. Keep it factual, keep it focused on your training and the situation you faced. Let the facts speak for themselves. The press conference began at exactly 1000 hours. Captain Torres stepped to the podium, her voice carrying the authority of high rank and absolute conviction. Good morning. I'm Captain Elizabeth Torres, Director of the Navy Nurse Corps. I'm here today to address a serious injustice being perpetrated against one of our own. Lieutenant Commander Evelyn Ward, retired, served this nation with distinction for 23 years. She deployed to combat zones, saved countless lives, and earned decorations that speak to her courage and competence under the most extreme circumstances imaginable. Torres paused, her gaze sweeping the room. Last Friday, Lieutenant Commander Ward used the skills she learned in service to her country to save a patient's life. She recognized a vascular emergency, intervened with precision and expertise, and kept that patient alive until definitive surgical care could be provided. For this, for doing exactly what we trained her to do, she has been suspended from her position at Riverside General Hospital and faces potential termination. The murmur that went through the reporters was immediate and audible. Cameras flashed. Someone shouted a question, but Torres continued. This is not about protocol. This is not about scope of practice. This is about a hospital administration more concerned with liability than with the fundamental mission of healthcare, saving lives. It is about institutional cowardice masquerading as policy enforcement, and it is categorically unacceptable. Torres stepped aside, and Colonel Cross moved to the podium with visible effort, his gait uneven, but his bearing military straight. I'm Colonel Daniel Cross, United States Marine Corps. I'm the patient that Lieutenant Commander Ward saved. Cross's voice filled the room with command presence that made even the reporters sit straighter. On Friday night, I walked into that emergency room suffering from a condition I didn't understand. I was arrogant. I was dismissive. When Nurse Ward tried to help me, I refused her assistance based on nothing but my own prejudice and ignorance. The admission hung in the air, stark and uncomfortable. I nearly died because of that arrogance. My femoral artery was rupturing, bleeding internally, and I was minutes from complete vascular collapse. Nurse Ward recognized what was happening when I couldn't, when the monitors hadn't caught up to the crisis, when every second mattered. Cross paused. She saved my life using a technique she learned performing combat medicine in Fallujah. She did it without hesitation, without concern for herself, without counting the cost. Cross's gaze swept the room. That cost is now apparent. She's being punished for her competence. She's being suspended for her courage. She's being persecuted by an institution that values procedure over patience and liability over life. His voice hardened. I am here to state, for the record, and for all to hear, that if Riverside General terminates Lieutenant Commander Ward's employment, they will be making the gravest mistake of their institutional existence. Because I will make it my personal mission to ensure that every veteran, every service member, every military family in this country knows what they did, and they will face consequences. The threat was clear, delivered with the calm certainty of someone who absolutely meant every word. Cross stepped back, and Torres gestured for Evelyn to approach the podium. The walk felt endless, every eye in the room tracking her movement. Evelyn gripped the podium edges, feeling the smooth wood beneath her fingers, grounding herself in the physical sensation. The cameras were bright, overwhelming, but she'd faced worse. She'd delivered death notifications to families. She'd held dying Marines who called for their mothers. She could speak truth to a room full of reporters. My name is Lieutenant Commander Evelyn Ward. I served in the Navy Nurse Corps for 23 years, with 3 deployments to Iraq as part of Marine Corps surgical teams. Her voice was steady, clear. I left active duty 6 years ago because I wanted to continue serving as a nurse without the weight of rank and decoration. I wanted to help patients simply because they needed help, not because it would earn me medals or recognition. She paused, gathering her thoughts. On Friday night, a patient came to my emergency department in crisis. He didn't know he was dying. I did. I recognized the signs because I'd seen them before, in field hospitals and forward surgical units, in situations where the choice was between immediate action and certain death. Evelyn's hands tightened on the podium. I performed a manual arterial compression to control internal bleeding until the patient could reach surgery. It's a technique I learned in combat, a skill I've used to save lives when there were no other options. The room was silent, every person focused on her words. I'm being told that what I did violated protocol, that I acted outside my scope of practice, that I created liability for my hospital. Evelyn's voice hardened slightly. What I did was save a man's life, and if faced with the same situation tomorrow, I would do it again. Because that's what nurses do. That's what healers do. We see suffering, and we act to stop it. We see death approaching, and we fight to hold it back. We don't check policy manuals while patients die. She looked directly into the cameras. I don't want to be a symbol. I don't want attention or recognition. I just want to do my job, to care for patients with all the skill and experience I possess. If Riverside General cannot accept that, if they believe that following procedure matters more than saving lives, then perhaps I don't belong there after all. Evelyn stepped back from the podium, her heart pounding, her hands trembling slightly with adrenaline. The room erupted with questions, reporters shouting over each other, cameras flashing in a strobe of light. Captain Torres stepped forward to field questions, and Colonel Cross gestured for Evelyn to follow him to a side door. In the quiet hallway beyond, Cross leaned against the wall with visible relief at escaping the crowd. "That was perfect," he said. "You were perfect." Evelyn didn't feel perfect. She felt exposed, vulnerable, like she'd stripped away every protective layer she'd built over 6 years and stood naked in front of the world. What happens now? Now we wait. The story will run tonight on every major network. By tomorrow morning, Riverside General will be facing a public relations nightmare. Their options will be simple: reinstate you with full apology or watch their reputation burn. And if they choose to burn, Cross's smile was predatory, then we let them. And you come work somewhere that actually appreciates what you're capable of. I've already had 3 different military hospitals reach out asking if you'd consider returning to active duty or accepting a civilian position at a VA facility. The thought of returning to military medicine sent a complicated mix of emotions through Evelyn. Fear, longing, regret, hope. She'd spent 6 years building a wall between herself and that identity, and Cross had just demolished it with a press conference and media coverage. Her phone buzzed. A text from an unknown number. "This is Margaret Hutchins. We need to talk. Hospital administration has called an emergency meeting regarding your situation. Can you come in tomorrow morning?" Evelyn showed the message to Cross. "They're panicking," he said with satisfaction. "Good. Let them panic." But Evelyn's mind was already racing ahead to the next confrontation, the next battle in a war she hadn't wanted to fight but could no longer avoid. She'd stepped forward. She'd told her truth. And now she would face whatever consequences came, armed with nothing but her record and her refusal to apologize for saving a life. The hallway felt too quiet after the chaos of the press conference. Evelyn stood there, still in her navy dress blues, feeling like a soldier who'd just survived a firefight, only to realize the real battle was still ahead. Her phone buzzed again. This time the message was from Richard Brennan, the risk management director. Press conference noted. Disciplinary hearing moved to tomorrow 900 hours. Attendance mandatory. Legal representation permitted. Cross read the message over her shoulder and his jaw tightened. They're going to try to bury this before the media coverage gains traction. They'll hold the hearing tomorrow, terminate you for cause, and issue a statement saying the matter was handled internally, according to proper procedure. Can they do that? They can try. Cross pulled out his own phone. But they're not going to succeed. I'm making another call. He stepped away, speaking rapidly in the clipped tones of military command. Evelyn leaned against the wall, exhaustion suddenly overwhelming her. The adrenaline was fading, leaving behind the crash that always followed. She'd given everything in that press conference, had exposed parts of herself she'd kept hidden for years, and now she had less than 24 hours before facing the people who held her career in their hands. Cross returned, his expression grim but determined. I just spoke with the Marine Corps Judge Advocate General's office. They're sending a military lawyer to accompany you to that hearing tomorrow, someone who specializes in veteran employment rights and discrimination cases. The hospital isn't discriminating against me because I'm a veteran. Aren't they? Cross's voice was sharp. They're punishing you for using skills you acquired through military service. They're holding you to a civilian standard that ignores your extensive combat medical training. That's discrimination, Evelyn. And we're going to make them see it.
Evelyn wanted to argue, wanted to maintain that this was simply about protocol and procedure, nothing more sinister. But she couldn't shake the memory of Richard Brennan's expression, the way he'd looked at her service record like it was an inconvenience rather than a credential. The way the lawyers had dismissed her experience as irrelevant to the hospital's liability concerns. Maybe Cross was right. Maybe this was about more than just one suspended nurse. Maybe it was about how the civilian world valued, or failed to value, the skills veterans brought with them when they returned from war. "I should go home," Evelyn said quietly.
"Prepare for tomorrow. Torres is arranging quarters for you here if you want them. Might be easier than driving back to Portland tonight." Evelyn nodded, too tired to argue. She followed Cross back through the building, past windows where she could see reporters still clustered outside, doing stand-ups for their evening broadcasts. Her face would be on the news tonight. Her story would be told and retold, analyzed and debated. There would be no going back to anonymity, no return to being just another nurse in faded scrubs. That person, that version of herself, was gone. In the guest quarters, Evelyn finally removed the navy dress blues and hung them carefully in the closet. She stood in the small room, staring at nothing, her mind blank with exhaustion and overwhelmed by the enormity of what she'd set in motion. A knock at the door startled her. When she opened it, she found a young Navy nurse, an ensign, fresh-faced and clearly nervous. "Ma'am, I'm sorry to bother you." "I'm Ensign Rodriguez. I wanted to thank you." Evelyn blinked. "Thank me for what?" "For standing up. For not backing down." Rodriguez's words came in a rush. "I'm headed to my first deployment in 3 months. I've been scared of not being good enough, scared of making mistakes, scared of facing situations I'm not ready for. But watching you today, hearing your story," she trailed off, emotions clearly overwhelming her. "You showed me what it means to be a Navy nurse, what it really means. Not just following procedures, but having the courage to do what's right, even when it costs you everything." Evelyn felt something shift in her chest, a crack in the armor of her exhaustion. This young nurse, this ensign about to face her own deployment, had found inspiration in Evelyn's forced exposure, had seen heroism where Evelyn only saw survival. "Ensign, the courage you need isn't about dramatic moments or press conferences. It's about showing up every day, doing your job with integrity, and caring for your patients like they matter, because they do. That's all I've ever done." "That's everything, ma'am." Rodriguez straightened slightly. "I just wanted you to know that what you did, standing up today, telling your truth, it mattered. To me, to a lot of us." After Rodriguez left, Evelyn sat on the edge of the bed, the ensign's words echoing in her mind. She'd fought the publicity, had resisted Cross's plan because she didn't want to be a symbol or an inspiration. But maybe the choice of what she represented wasn't entirely hers to make. Maybe by standing up, by refusing to accept unjust punishment quietly, she'd become something larger than her own preferences. The thought was both terrifying and strangely liberating. Her phone buzzed with a news alert. Decorated Navy nurse suspended after saving Marine's life. Hospital faces backlash. The article had already gone viral, shared thousands of times across social media. The comments ranged from outraged support to skeptical questions to a few defending the hospital's right to enforce its policies. Evelyn read through them with detached fascination, watching strangers debate her choices, her competence, her worth. Some called her a hero. Some said she was irresponsible. Most just seemed confused that a nurse could be punished for saving a life. Another message appeared, this one from Dr. Peterson. "Evelyn, I don't know if you'll see this, but you should know. Half the ER staff has signed a letter demanding your reinstatement. We're submitting it to administration tomorrow before your hearing. What they're doing to you is wrong, and we're not going to stay silent about it." The message brought tears to Evelyn's eyes, the first she'd allowed herself since this entire nightmare began. Her colleagues, the people she'd worked beside for 6 years, were standing up for her, fighting for her, refusing to let the administration's narrative go unchallenged. She wasn't alone in this fight. She'd never been alone. Evelyn slept fitfully, nightmares of Fallujah mixing with anxiety dreams about the coming hearing. When her alarm went off at 0600, she felt like she'd barely slept at all. But she showered, dressed in civilian clothes, slacks and a blazer, professional but not the uniform, and prepared herself for battle. The military lawyer arrived at 0730. Major Catherine Sharp was 40-something, sharp-eyed, with the bearing of someone who'd spent years fighting institutional battles. She carried a briefcase full of documents and a recording device. "I've reviewed your case," Sharp said without preamble. "The hospital's position is legally weak but politically defensible. They'll argue that protocol violations, regardless of outcome, create unacceptable liability. We'll counter that your military training and experience supersede their standard nursing protocols, and that punishing you constitutes discrimination against veterans. Will that work? In court? Probably. But we're not going to court today. Today we're going to a disciplinary hearing which operates under different rules." Sharp's expression was grimly professional. "They can terminate you for violating policy even if your violation saved a life. The question is whether they're willing to face the public relations consequences." They drove to Riverside General in Sharp's rental car, arriving 30 minutes before the scheduled hearing. The hospital parking lot was crowded with news vans. The media had tracked the location and were waiting for a statement. Security guards stood at the main entrance, clearly overwhelmed by the attention. Inside, the tension was palpable. Staff members stared at Evelyn as she passed, some with support in their eyes, some with wariness, some with the blank expression of people trying to avoid involvement. She made her way to the administrative wing, where Richard Brennan's secretary directed them to a large conference room. The hearing panel was already assembled. Richard Brennan sat at the center, flanked by the two lawyers from the previous meeting. Margaret Hutchins was there as well, looking distinctly uncomfortable. And at the end of the table sat someone new, a tall man in an expensive suit, his nameplate reading Gerald Foster, Hospital CEO. Foster's presence elevated this from a routine disciplinary matter to something much more significant. Evelyn felt her anxiety spike, but Sharp's hand on her arm was steadying. "Showtime," Sharp murmured. "Remember, answer only what they ask, don't volunteer information, and let me handle the legal arguments." They took their seats across from the panel. Brennan cleared his throat and began reading from a prepared statement, outlining the charges. Performing procedures outside scope of practice, violating hospital protocols, creating liability exposure, failure to follow proper chain of command during emergency response. Each accusation was technically accurate. Evelyn had done all those things. The question was whether they mattered more than the life she'd saved. When Brennan finished, Foster leaned forward. "Ms. Ward, before we proceed, I want to make something clear. This hospital values our nurses. We recognize your years of service here and your generally excellent record, but we cannot allow personal initiative, however well-intentioned, to supersede established procedures." "Then you value procedures over patients," Evelyn said quietly, before Sharp could stop her. Foster's eyes narrowed. "We value both, but procedures exist for reasons, to ensure consistent, safe, legally defensible care. Colonel Cross is alive because I ignored your procedures." Evelyn's voice remained calm but carried absolute conviction. "If I had waited for authorization, if I had followed proper channels, he would have died." "Are you saying that would have been preferable?" "I'm saying," Foster replied carefully, "that the outcome doesn't justify the means when the means create systemic risks." Sharp cut in smoothly. "Mr. Foster, are you aware that Miss Ward's military medical training exceeds the requirements for civilian nursing practice? That her combat experience includes procedures and interventions far beyond what your protocols contemplate? Miss Ward's military service is noted in her file. However, she was hired as a civilian nurse and is held to civilian standards. Standards that would criminalize the very skills that make her an exceptional emergency nurse?" Sharp's voice sharpened. "Standards that essentially require her to forget everything she learned serving this country?" One of the lawyers intervened. "Major Sharp, this hearing is not about Ms. Ward's military service. It's about her actions on the night in question and whether those actions align with hospital policy." "They saved a life," Sharp stated flatly. "They violated protocol," Brennan countered. The argument continued, legal volleys exchanged across the conference table. Evelyn sat silently, watching the battle being fought over her career, her choices, her worth. She thought about Ensign Rodriguez's words, about courage and integrity and showing up. She thought about the ER staff's letter of support. She thought about Colonel Cross's promise that the truth would be known. Finally, Foster raised his hand, silencing both sides. I think we've heard enough argument. Miss Ward, do you have anything to say before we render our decision? Evelyn stood slowly, ignoring Sharp's warning look. She'd let others fight for her, had accepted their help and support, but these final words needed to be hers alone. I became a nurse because I wanted to help people. I joined the Navy because I wanted to serve. I deployed to combat zones because Marines needed surgical care, and I had the skills to provide it. Her voice was steady, clear. I've spent 29 years, 23 in the Navy, 6 here, doing exactly one thing, caring for patients with everything I have, every skill, every bit of knowledge, every ounce of courage I possess. She looked at each panel member in turn. Friday night, I used those skills to save Colonel Cross's life. I did it without hesitation because that's who I am. That's what nurses do. And if you fire me for that, if you tell me that my training and experience and competence matter less than your liability concerns, then you're telling every veteran nurse in this country that their service doesn't count, that the skills they learned protecting this nation can't be used to protect your patients. Evelyn's hands were steady on the table. So, yes, I violated your protocols. I acted outside my scope of practice as you define it. I created liability exposure, and I saved a man's life. If I had to make that choice again tomorrow, I wouldn't change a single thing. She sat down. The room was silent for a long moment. Then Gerald Foster opened a folder in front of him and pulled out a single sheet of paper. Ms. Ward, this is your termination notice, effective immediately. The words hung in the air like a death sentence. Evelyn stared at the termination notice, watching Foster slide it across the polished conference table. Major Sharp's hand shot out, intercepting the document before Evelyn could touch it. On what grounds? Sharp's voice was ice cold, controlled fury barely contained beneath professional veneer. Gross violation of hospital protocol, practicing outside scope of licensure, creating unacceptable liability exposure, and insubordination. Foster's tone was equally controlled, rehearsed. Ms. Ward's employment is terminated effective immediately. She will be escorted from the premises and the conference room door slammed open with enough force to crack against the wall. Colonel Daniel Cross stood in the doorway, still in dress uniform despite the surgical pain that carved lines across his face. Behind him stood Captain Elizabeth Torres, 2 other Marine officers Evelyn didn't recognize, and a cameraman with a shoulder-mounted unit actively filming. "You're making a mistake," Cross said, his command voice filling every corner of the room. Foster's face went pale, then flushed red. "This is a private disciplinary hearing. You have no right—" "I have every right. I'm the patient whose life she saved." Cross moved into the room with deliberate steps, each movement controlled despite obvious discomfort. "And I'm also a material witness to the events in question. You can't render a decision without hearing my testimony." Brennan stood abruptly. "Colonel, we have medical records and staff reports. Your testimony isn't necessary for—" "Isn't necessary." Cross's laugh was harsh, cutting. "You're firing a nurse for saving my life, and you don't think my perspective is necessary." He turned to the cameraman. "Are you getting this? Hospital CEO Gerald Foster just stated that the patient's testimony isn't necessary when evaluating emergency medical care." Foster's jaw clenched. "Turn that camera off, now." "This is a public interest matter," Torres interjected smoothly, stepping forward. "As director of the Navy Nurse Corps, I'm here to ensure that one of our veterans receives fair treatment. The presence of media documentation serves that interest." "This is outrageous," one of the hospital lawyers sputtered. "You can't just barge into a private hearing with cameras and—" "Watch us." The Marine officer beside Torres spoke for the first time. His nameplate read Lieutenant Colonel James Morrison. "We've already filed a formal complaint with the State Nursing Board regarding this hospital's discriminatory practices toward veteran healthcare workers. We've also contacted the Veterans Affairs Office of Inspector General about potential systemic issues affecting veteran employment. Would you like us to add obstruction of witness testimony to those complaints?" The threat was clear and devastating. Foster's expression shifted from anger to calculation, the look of someone rapidly reassessing the battlefield. "Fine. Colonel Cross, you have 5 minutes. I'll take as long as necessary. Cross pulled out a chair directly across from Foster and sat with visible effort. Let's start with the facts. On Friday night, I walked into your emergency room with a ruptured femoral pseudoaneurysm. Do you know what that is, Mr. Foster? I'm familiar with medical terminology. Then you know that condition has a mortality rate exceeding 90% if not treated immediately. You know that I had at most minutes before complete vascular collapse. You know that standard emergency protocols, the ones you're so concerned about, would have been too slow to save my life. Cross leaned forward. Lieutenant Commander Ward recognized my condition when your monitors hadn't, when your standard assessments hadn't, when I myself didn't understand what was happening. She recognized it because she's performed emergency vascular interventions on Marines bleeding out from IED strikes and gunshot wounds in field hospitals where the only equipment was what you could carry in a pack. Foster remained silent, his expression carefully neutral. When I coded, when my heart stopped, and your emergency team was scrambling to respond, she did something extraordinary. She performed a manual arterial compression using a technique taught exclusively in military combat medicine, a technique that requires precise anatomical knowledge and significant physical strength maintained over 8 sustained minutes. Cross's voice dropped, became quieter, but somehow more powerful. Do you know how I know she held that compression for exactly 8 minutes? I'm sure you'll tell us, Foster said dryly. Because I counted them. While I was dying, while I was fading in and out of consciousness, I counted her steady pressure against my femoral artery. I felt her hands never waver, never falter, never give up even when her arms must have been screaming with fatigue. Cross paused. Your protocols would have had her wait for physician authorization. By the time that authorization came, I would have been dead. Are you genuinely prepared to say that would have been the preferable outcome? This isn't about outcomes, Brennan interjected desperately. It's about following established procedures that ensure safety? Cross cut him off. Consistency? Legal protection? His gaze swept the panel. Let me tell you what your procedures ensure. They ensure that veteran nurses who possess extraordinary skills, learned through service to their country, must pretend to be less competent than they actually are. They ensure that in moments of crisis, when lives hang in the balance, your staff will hesitate, will check protocols and seek authorization instead of acting on their training and experience. Morrison pulled a folder from his briefcase and slid it across the table. These are sworn statements from 7 different emergency physicians who have worked with Lieutenant Commander Ward over the past 6 years. Every single one states that her clinical judgment and emergency response capabilities exceed standard nursing practice. Every single one confirms that her military medical training makes her one of the most competent emergency providers on your staff. One of the hospital lawyers grabbed the folder, scanning quickly through the documents. Her expression shifted, became uncertain. We also have testimony from Dr. Sarah Kim, the vascular surgeon who operated on Colonel Cross, Torres added. Dr. Kim states unequivocally that the manual compression technique Ward employed was medically appropriate, correctly executed, and directly responsible for keeping Colonel Cross alive until surgery. She further states that the technique, while not commonly known in civilian practice, is a standard intervention in military field medicine and should be considered within the scope of practice for nurses with Ward's training and experience. Foster's fingers drummed against the table, a tell of growing anxiety. These statements don't change the fundamental issue. Miss Ward acted without authorization, violated hospital protocol, and saved a man's life, Cross finished. Say it. Complete the sentence honestly. She violated your protocols and saved a man's life. The silence stretched. Finally, Foster spoke, his voice tight. The board has made its decision. Miss Ward's termination stands. Then you leave us no choice. Morrison stood, his bearing radiating military authority. As of this moment, the Marine Corps is formally severing all partnership agreements with Riverside General Hospital. That includes your residency program that trains military physicians, your research grants funded through Department of Defense contracts, and your preferred provider status for active duty and veteran care. Foster's face went white. You can't. That's millions of dollars in annual revenue. We can, and we are. Effective immediately.
Morrison's voice was implacable. Furthermore, the Navy Nurse Corps is issuing a formal advisory to all veteran nurses currently employed at this facility or considering employment here. We're recommending they seek positions elsewhere, at institutions that actually value their service and competence. That's economic warfare, the hospital lawyer said, her voice rising. That's consequences, Torres corrected. You want to fire a decorated veteran for being too good at her job? Fine.
But you'll do it without military partnerships, without DoD funding, and without the credibility that comes from association with the armed services medical community. Evelyn sat frozen, watching the battle unfold around her. This had escalated beyond anything she'd imagined, beyond a single nurse's termination, beyond one hospital's policies. This had become a line in the sand, a statement about how civilian institutions treated veterans who brought extraordinary skills home from war. Foster's phone buzzed. He glanced at it and something in his expression cracked. "Excuse me." He stood abruptly and left the conference room, the door closing behind him with a sharp click. Brennan and the lawyers exchanged worried looks. Through the door, Evelyn could hear Foster's voice rising, though she couldn't make out the words. The conversation lasted perhaps 3 minutes. 3 minutes of uncomfortable silence in the conference room, everyone waiting for the other shoe to drop. When Foster returned, his face was ashen. "That was our board of directors chair. Apparently the story about Lieutenant Commander Ward's termination broke on national news 15 minutes ago. Our main phone line has been overwhelmed with calls, most of them extremely negative. We've received termination notices from 3 major insurance providers who don't want to be associated with an institution that persecutes veterans, and 2 members of our board have resigned in protest." He sat down heavily. "The board chair has instructed me to resolve this situation immediately." "By resolving, you mean reversing your decision," Sharp said, her tone making it clear this wasn't a question. Foster's jaw worked. "We're prepared to offer Ms. Ward reinstatement with full back pay and—" "No!" Evelyn's voice cut through the room, surprising everyone, including herself. All eyes turned to her. Foster blinked. "I'm sorry?" "I said no." Evelyn stood, her heart pounding but her voice steady. "You fired me. You made it clear that my skills, my experience, my competence, all of it matters less to you than covering your liability exposure. You looked at what I did, at the life I saved, and decided that protocols mattered more. Miss Ward, I understand you're upset, but I'm not upset. I'm done." Evelyn's voice carried the weight of every year she'd spent proving herself, being underestimated, swallowing dismissals. "You can't fire me and then take it back because it became inconvenient. You made your choice. Now live with it." Foster's desperation was palpable. "Please be reasonable. We can discuss terms, additional compensation, a formal apology." "I don't want your apology." Evelyn picked up the termination notice that had started this confrontation. "This document represents exactly what you think of nurses like me. Keep it. Frame it. Let it remind you of the day you chose policy over patients and lost everything that mattered." She turned to Major Sharp. "Is there anything else legally required here?" Sharp's smile was sharp, satisfied. "Not a thing. You're free to go." Evelyn walked toward the door, passing Cross, who nodded once with deep respect. She'd almost reached the hallway when Foster's voice stopped her. "Wait, please." The CEO's composure had completely shattered. "Lieutenant Commander Ward, I'm begging you, if you walk out of here, if this termination stands, Riverside General will be destroyed. We'll lose accreditation, funding, reputation, everything. Hundreds of employees will lose their jobs. Patients will lose access to care." Evelyn turned slowly. "That's not my responsibility. That's yours. You built this situation. You made these choices. The consequences are yours to bear." "I made a mistake," Foster said, and for the first time he sounded genuinely human rather than corporate. "I was wrong. About you, about the situation, about what matters. Please, don't let everyone else pay for my failure." The plea hung in the air. Evelyn studied Foster's face, seeing genuine fear and regret battling for dominance. She thought about the staff members who'd supported her, Dr. Peterson, the ER nurses, even young Jessica from intake. She thought about the patients who relied on Riverside General for their care. If I agree to return, Evelyn said slowly, things change. Completely. Not just for me, for every nurse, every provider, every staff member who's ever been told their experience doesn't matter because it doesn't fit neatly into protocol. Name your terms, Foster said immediately. First, my termination is publicly reversed with a full institutional apology acknowledging that my actions were medically appropriate and potentially life-saving. Second, hospital protocols are revised to recognize military medical training as qualifying nurses for expanded scope of practice in emergency situations. Third, veteran healthcare workers receive mandatory review of their service records to ensure their full capabilities are properly documented and utilized. Evelyn paused, making sure Foster understood each word. Fourth, you establish an emergency medicine advisory committee composed of nurses and physicians with equal representation that reviews all protocols and has authority to recommend changes. Fifth, Richard Brennan is removed from any role involving clinical staff discipline. Brennan's face went purple. You can't. I'm the director of. Sixth, Evelyn continued as if he hadn't spoken. You make a $5 million donation to the Navy Marine Corps Relief Society in support of military medical personnel transitioning to civilian healthcare careers. And seventh, you personally author an editorial in the Journal of Emergency Medicine explaining what happened here and why institutional policies must never supersede clinical judgment in life-threatening situations. The terms were devastating, designed to strip Foster of pride and force institutional reform. Evelyn watched him process each requirement, saw the calculations running behind his eyes. Finally, he nodded. Agreed. All of it. Get it in writing, Sharp said immediately. Full legal documentation signed by Foster and the board chair, filed with the State Hospital Licensing Authority. Until those documents are executed, Lieutenant Commander Ward's termination remains in effect. Foster pulled out his phone. I'll have our legal team draft everything within the hour. Your legal team has proven themselves unreliable. Morrison gestured to the two lawyers who'd sat silent through most of the confrontation. We'll provide the document templates. Your people can review, but changes will be minimal. The lawyers looked to Foster, who simply nodded his acquiescence. The meeting dissolved into logistics, Morrison and Sharp coordinating with Foster's staff, Torres making calls to temporarily halt the military partnership severance, Cross sitting quietly, but maintaining his presence as a reminder of what this was really about. Evelyn found herself standing in the hallway outside the conference room, the adrenaline finally draining away and leaving exhaustion in its wake. Dr. Peterson appeared from somewhere down the corridor, his expression hopeful and anxious. I heard shouting. What happened? They fired me, Evelyn said simply. Peterson's face fell. Jesus. Evelyn, I'm so... Then I refused to accept reinstatement until they agreed to institutional reform, public apology, and a $5 million charity donation. Peterson's mouth opened, closed, opened again. But what? They chose policy over patience. I made them pay for that choice. Evelyn felt a strange lightness, almost giddy. Foster is writing new protocols, establishing nurse oversight committees, and probably regretting every decision that led to this moment. Peterson started laughing, a sound of pure relief and amazement. That's the most badass thing I've ever heard. You basically held the entire hospital hostage until they agreed to institutional reform. I held them accountable, Evelyn corrected. There's a difference. Within 90 minutes, the documents were ready. Morrison and Sharp had drafted comprehensive agreements covering every term Evelyn specified, with additional legal protections ensuring the hospital couldn't retaliate in subtle ways. Foster signed each page with visible reluctance, his hand shaking slightly. The board chair participated via video conference, her expression suggesting she'd aged a decade in the past few hours. This is legally binding, Sharp said, sliding the final executed copy toward Evelyn. Violation of any term gives you grounds for immediate legal action with automatic damages. They can't touch you now. Evelyn held the document, feeling its weight both literal and metaphorical. She'd gone from suspended nurse to terminated employee to architect of institutional change in less than a week. The journey felt surreal, impossible. There's one more thing, Foster said quietly. The media is still outside. They're going to want a statement about what happened here today. Let them wonder, Evelyn replied. I'm not doing another press conference. I am. Foster's voice was resigned. I'm going to explain exactly what happened, what we did wrong, and how we're changing. It's part of taking responsibility. Torres stepped forward. Mr. Foster, I'm going to accompany you to that press conference. The Navy Nurse Corps wants to ensure your statement accurately represents both the situation and our veteran nurses' capabilities. Of course. Foster looked at Evelyn one more time. Lieutenant Commander Ward, I genuinely hope you'll choose to return to work here. I understand if you don't, but we need nurses like you, desperately. I'll think about it, was all Evelyn said. The press conference happened an hour later in the hospital's main lobby. Evelyn watched from a distance, standing with Cross and Morrison near the cafeteria entrance where they had a clear view, but remained out of camera range. Foster stood behind a podium, looking like a man facing execution, while Torres stood just to his left, a subtle but clear indication of military oversight. I'm Gerald Foster, CEO of Riverside General Hospital. I'm here to address the termination and subsequent reinstatement of Lieutenant Commander Evelyn Ward. Foster's voice was steady despite his obvious discomfort. This morning, we made a serious mistake. We fired an exceptional nurse for using skills and training acquired through military service to save a patient's life. We prioritized protocol adherence over clinical judgment, institutional liability over patient welfare, and policy over people. The reporters leaned forward, sensing blood in the water. Lieutenant Commander Ward performed a medical intervention that fell outside standard civilian nursing practice, but well within the scope of her military medical training. She recognized a critical emergency that our standard assessments initially missed. She acted with precision and expertise to keep a patient alive until definitive surgical care could be provided. And we punished her for it. Foster paused, his jaw tight. That ends today. We've not only reinstated Lieutenant Commander Ward with full back pay and benefits, but we've agreed to comprehensive institutional reforms. These include revised protocols recognizing military medical training, establishment of nurse-led advisory committees, mandatory review of veteran healthcare workers' capabilities, and a $5 million donation to support military medical personnel transitioning to civilian careers. The murmur from the assembled reporters was immediate and loud. Cameras flashed. Someone shouted a question, but Foster raised his hand. More importantly, I'm publicly acknowledging that Riverside General's institutional culture needs to change. We've become so focused on liability protection that we've lost sight of our fundamental mission, saving lives. Lieutenant Commander Ward reminded us of that mission in the most direct way possible. She did her job with courage and competence, and instead of celebrating her, we tried to silence her. Torres stepped to the microphone. The Navy Nurse Corps wants to emphasize that Lieutenant Commander Ward represents thousands of veteran healthcare workers across this country. They bring extraordinary skills, unmatched experience, and proven courage to civilian healthcare. Institutions that fail to recognize and utilize those capabilities are not just making poor administrative decisions, they're denying patients access to some of the most competent medical providers available. The press conference continued, but Evelyn stopped watching. She turned away from the spectacle, walking back through the hospital corridors that had been her workplace for 6 years. Staff members who'd avoided her earlier now approached with words of support, apologies for their silence, congratulations on her victory. She accepted them all with quiet grace, but her mind was elsewhere. Cross fell into step beside her, his gait still uneven but determined. You did it. You won. Did I? Evelyn's voice was thoughtful. Foster agreed to my terms because he had no choice. The hospital reforms because they're protecting themselves from future liability, not because they've genuinely changed their values. The moment the media attention fades, the moment the pressure lifts, they'll slide back toward the same institutional cowardice that created this situation. Maybe, Cross conceded, but you've established a precedent. You've shown what happens when institutions try to punish competence. Other hospitals will think twice before doing what Riverside did. They reached the ER entrance, where the familiar chaos of emergency medicine continued unabated. A child crying in triage, the beep of monitors, the urgent voices of providers managing crisis after crisis. This was what Evelyn had missed during her suspension, Not the validation or recognition, but the simple act of helping people when they needed it most. Dr. Peterson emerged from a trauma bay, blood on his scrubs, exhaustion in his eyes. When he saw Evelyn, his expression brightened. "Please tell me you're coming back." "I don't know yet," Evelyn admitted. "A lot has happened. I need time to process it all." "Take whatever time you need, but know that we want you here. Not because of your military record or your decorations or the press coverage, because you're an exceptional nurse who makes everyone around you better at their jobs." Peterson's sincerity was evident. "We need that. I need that." Evelyn felt the pull of belonging, the call of purpose, but she also felt the weight of everything that had been exposed, revealed, laid bare for public consumption. She'd wanted anonymity, had built 6 years of careful distance from her military identity. That was gone now, shattered by necessity and circumstance. "I'll let you know," she promised. Over the following week, Evelyn's story rippled outward with effects she couldn't have predicted. 3 other hospitals contacted her with job offers, each trying to outbid the others with salary packages and positions. A major medical journal requested she author an article on combat medicine techniques applicable to civilian emergency care. The Secretary of Veterans Affairs mentioned her case in a speech about veteran employment rights. And through it all, Evelyn stayed in the guest quarters at Walter Reed, processing and thinking and trying to understand who she was now that all her carefully constructed walls had been demolished. Colonel Cross was released from the hospital on day 6, his recovery progressing faster than expected. Before he left, he stopped by Evelyn's quarters. "I'm heading back to active duty next month," he said. "Light duty at first, but I'll be fully operational within 6 months, because of you." "I'm glad." Evelyn meant it sincerely. "I've been thinking about what you said, about wanting to be just a nurse, not a symbol or inspiration." Whoosh, Cross's expression was thoughtful. "I understand that desire. After my first deployment, I tried to leave the Marine Corps. Thought maybe I could build a different life, be someone other than a warrior. But that identity isn't something you can just set aside. It's woven into who you are, shapes how you see the world, and respond to crisis." "What changed your mind about leaving?" "I realized I wasn't running toward something better. I was running away from something difficult." Cross met her eyes. "You're a warrior, Evelyn. You always have been. The uniform doesn't matter, navy blues or civilian scrubs. You're still fighting to save lives against impossible odds. The only question is where you fight and under what terms." The words settled into Evelyn's thoughts, adding weight to decisions she still hadn't made. On day 8, Margaret Hutchins called. "Evelyn, I know you're still deciding about coming back, but there's something you should know. Richard Brennan was fired yesterday. Not reassigned, fired. Foster personally escorted him out of the building." "I didn't ask for that," Evelyn said, though she felt no sympathy for Brennan. "You didn't have to. Foster's cleaning house, getting rid of anyone who contributed to what happened to you. He's terrified you'll change your mind about the settlement." Margaret paused. "For what it's worth, I should have stood up for you sooner. I knew what they were doing was wrong, but I was afraid of risking my own position. That was cowardice, and I'm sorry." "You stood up eventually," Evelyn replied. "That counts for something." "Does it count enough for you to come back?" The question lingered in Evelyn's mind long after the call ended. She walked the grounds of Walter Reed, watching military medical personnel go about their duties with the efficiency and purpose she remembered from her active duty years. She visited the Wounded Warrior Ward, where service members recovering from combat injuries reminded her why she'd become a nurse in the first place. And slowly, gradually, she came to understand what Cross had been trying to tell her. She'd spent 6 years trying to be someone other than Lieutenant Commander Evelyn Ward, but that identity wasn't a burden she could shed. It was a foundation she'd built her entire professional life upon. Denying it didn't make it disappear. It just meant she was operating at half capacity, using only part of her skills and experience because she was afraid of being seen as too much. But she was too much. Too skilled, too experienced, too competent for most civilian emergency departments. And instead of apologizing for that or hiding it, maybe it was time to embrace it fully. On day 10, Evelyn made her decision. She called Gerald Foster directly, bypassing administrative channels. "I'm ready to discuss my return to Riverside General, but not as a staff nurse."
Foster's relief was audible. Name your position. Director of Emergency Medicine Clinical Excellence. I want authority to redesign ER protocols, implement combat medicine techniques where appropriate, and train your entire emergency department staff in advanced life-saving interventions. I want full administrative authority over clinical education and the ability to hire additional staff with military medical backgrounds. The silence on the other end lasted several heartbeats. That's a significant expansion of scope. It's also what your institution needs. You said yourself that you'd lost sight of your fundamental mission. I can help you find it again, but only if you're willing to let me actually lead instead of just window dress with a decorated veteran and a meaningless title. What kind of salary are we talking about? Evelyn named a figure that would have seemed impossible a month ago. Foster didn't even hesitate. Done. When can you start? 2 weeks? I need time to prepare. And to make peace with who she was becoming, or rather, who she'd always been, but had been afraid to acknowledge. The news of her return and new position hit the medical community like a shockwave. Several prominent physicians publicly criticized the move, calling it capitulation to media pressure, an inappropriate elevation of nursing roles. But many more, especially those with military backgrounds, celebrated it as recognition of the extraordinary value combat-trained medical personnel brought to civilian healthcare. Evelyn ignored both the critics and the supporters. She had work to do. She spent her 2 weeks off designing new protocols, researching combat medicine techniques adaptable to civilian emergency care, and reaching out to veteran nurses across the country about potential positions at Riverside General. She built a comprehensive training program that would transform Riverside's emergency department into something unprecedented, a hybrid civilian-military medical model that combined the best of both worlds. And on her first day back, she walked through the ER doors not in faded scrubs, but in professional attire that commanded respect. Her posture military straight, her bearing that of someone who knew exactly who she was and what she was worth. The emergency department staff gathered for her introductory address. Evelyn looked out at the assembled nurses, physicians, technicians, and support staff. Some familiar faces, some new hires attracted by the promise of learning from a decorated combat veteran. I'm Lieutenant Commander Evelyn Ward, and I'm here to change how emergency medicine works at this institution, she began. Not because I think I'm better than any of you, but because I've seen what's possible when medical professionals are empowered to use their full capabilities instead of being constrained by protocols designed to limit liability rather than save lives. She let the words sink in. Over the next 6 months, we're going to implement systems and techniques that will make this emergency department one of the most effective in the country. You're going to learn interventions that most civilian providers never encounter. You're going to be challenged, pushed beyond your comfort zones, and held to standards that will seem impossibly high. Evelyn's gaze swept the room, making eye contact with each person. But in return, you're going to save lives that would otherwise be lost. You're going to make split-second decisions with confidence instead of hesitation. You're going to become the kind of providers that other hospitals envy and patients trust completely. The energy in the room shifted, uncertainty giving way to anticipation. Starting tomorrow, we begin. But today, I want to know one thing from each of you. Are you ready to be exceptional, or are you content with adequate? The response was a chorus of voices affirming readiness, accepting the challenge she'd laid out. Evelyn felt satisfaction settle into her bones. This was right. This was where she belonged, not hiding her capabilities, not apologizing for her competence, but leading others toward excellence. As the staff dispersed to their duties, Dr. Peterson approached with a smile. That was intense and perfect. It was honest, Evelyn corrected. I'm done pretending to be less than I am. Good. We need you exactly as you are. Lieutenant Commander Ward, decorated veteran, exceptional nurse, and now our Director of Clinical Excellence. Peterson's expression turned more serious. For what it's worth, watching you fight this battle changed how I think about nursing leadership. You didn't just defend yourself, you forced an entire institution to evolve. That's real leadership. Evelyn was about to respond when her pager buzzed. A trauma alert, mass casualty incident, multiple ambulances incoming. The familiar surge of adrenaline hit immediately, her mind already shifting into crisis mode. Let's go, she said, breaking into a run toward the ambulance bay with Peterson beside her. This was what she'd been made for, the chaos, the urgency,
the split-second decisions that determined who lived and who died. She'd tried to leave it behind, had spent 6 years building a quieter life. But quiet had never suited her. She was a warrior in nurse's clothing, and it was time to stop apologizing for that truth. The ambulances screamed to a stop outside, and Evelyn stepped forward to meet them, her team forming up behind her with the discipline and precision of soldiers preparing for battle. And somewhere in the administrative offices above, Gerald Foster watched the emergency department's security camera feeds and understood exactly what kind of leader he'd almost destroyed and what it had cost him to bring her back. The mass casualty incident was a multi-vehicle pileup on the interstate. 6 cars, 2 trucks, 17 patients ranging from minor injuries to critical trauma. Evelyn moved through the organized chaos with the fluidity of someone who'd triaged hundreds of casualties under far worse conditions. She assigned resources, prioritized patients, made life-and-death decisions in seconds rather than minutes. A young resident froze when faced with a patient in traumatic arrest, his hands hovering uselessly over the chest compressions he knew he should start. Evelyn stepped beside him, her voice cutting through his panic. Breathe, assess, act, in that order. She demonstrated the rhythm of compressions, and the resident's training kicked in, his hands moving with newfound confidence. Within 20 minutes, every patient had been stabilized, triaged, and assigned to appropriate care teams. The ambulance bay returned to its baseline chaos, controlled, purposeful, alive with the energy of medical professionals doing what they were trained to do. Dr. Peterson found Evelyn in the trauma bay afterward, reviewing charts.